Hey guys, thanks for tuning in to the channel. Had a couple of ACL surgeries come in this week, so I just thought I'd give you guys a little bit of a rundown on what an ACL injury is and sort of what we do here at Thornton Physio and why we may be a little bit different. ACL injuries have garnered a lot of media attention in the last few years, so I think the local community really understand and appreciate what they are, but I guess some of the basics, the ACL is a ligament in your knee. Its main role is to provide deceleration and twisting pivoting support. I guess probably the biggest question we get is, will I be able to live on without my ACL? You can live a perfectly normal and healthy life forever without an anterior cruciate ligament. You can continue to run, triathlon, marathons, bike, swim, gym, tennis, ski, snowboard. You can do lots and lots of things. However, if you wish to do high velocity pivoting sports such as soccer, AFL, netball, then for the longer term safety of your knee and to reduce your arthritis risk, then having an ACL present is a much better option. So I guess what causes these? There are many causes that go into it, but I guess the three types of injuries we see are people either landing from a jump, decelerating and making an unplanned change of direction, aka a defender trying to change his speed and direction in touch football, or if you are the person with the ball trying to make a step to beat someone in that sort of defensive line. We do see contact injuries where someone has fallen on the knee awkwardly and forced that, but these are definitely the minor. They're only really about 20% of all ACL injuries. I guess risk factors. Female athletes are at risk. There's certain physiology things, especially related to estrogen and their cycle, that can impact their ACL stiffness. They also have different hip and muscle capacity that places them at higher risk. The younger you are, the more high risk you are. So we tend to see 15 to 22-year-olds are our highest risk group. The rate of ACLs after 22 does go down quite significantly. If you've had a previous knee injury, such as a meniscal or an ACL, that puts you at more risk of having another ACL. So it's really common with inadequate rehabs that we see people injure the other side after their ACL surgery. You can have muscle imbalances as well. We tend to sort of talk about in rehab that quad is king. So the bigger your quad, the better you'll be. So a weakness in quads and glute and core muscles can definitely impact that. So I guess what do we try and do? Prevention is king. Once you've had a cruciate, the knee is altered. Surgery can do a very good job at redressing that, but the best case is to never have a cruciate ligament in the first place. So we do know that when you do balance and plyometric training in warm-ups, that you can reduce your injury rate by about 60%. We also know that doing strength training, so squats, lunges, things that get the quad and the glute going really well, will definitely lower your chance of injury as well. So we do suggest to footballers that they should be attending the gym once or twice a week to do a program. And then in the warm-up, so netball has the netball knee program, soccer has the FIFA 11, AFL has a very similar program, and these warm-ups are designed to reduce ACL injuries. They reduce about 60%, which is really powerful. So, if you're a coach, that's one less ACL in your team a year, which, is really important. Bracing and taping can play a part, but we wouldn't really do that from a prevention strategy. We'd only really address that in a rehab if needed. So that's a little summary of what ACL injuries are. I guess we see a lot of these in the clinic. We have a specialised gym that's free to access for our patients so they can complete their rehab and make sure they get to that finish line and get back to their sport and enjoying themselves. But we're very proactive about preventing them. So if you're a coach or a parent of a club, we happily offer a free service where we come out and run a warm-up for your team, show you how to run that warm-up, and that's designed to try and keep all your players and your family on the field and not really on our bed. If you do have any questions about an ACL injury, please shoot me a comment, shoot me a message. I'm more than happy to answer it because there can be a lot of differences and nuances to this injury. Have a good day, guys. Bye.